Hi guys. So for today's video, we're going to talk a little bit about gum disease and how your oral health can actually reflect your overall health. So, well, have you ever thought that something happening inside your mouth could actually be the reflection of a deeper problem in your body? Uh, that itchy portion of your gums which acts out after meals and then, maybe goes away after a while, that could be your body's way of telling you that it needs attention and that there might be something wrong, and that there might be a larger issue that is requiring your attention. Hopefully by the end of this talk, you would have a greater appreciation of how the mouth acts as a mirror for your overall health. But let's first look at an incident that we had at the clinic once, to better understand where I'm coming from. So we had a patient come in once who complained of finding it nearly impossible to eat regular food of late. She said that her gums were bleeding every morning she woke up, and they were swollen and they were boggy. She couldn't imagine touching her own gums because, well, they would bleed at the slightest touch. So you can imagine it's a pretty distressing condition the patient was in. This, she said, had been getting worse with pretty much every passing day. So when we actually got down to it and we examined her mouth, well, sure enough, her gums were swollen and shiny red. They bled to the slightest of touch. So, well, what was intriguing was that her teeth were quite clean, and she wasn't particularly in any sort of pain. So this was a little surprising. And to add to this, she said that everyone in her family, they brushed their teeth diligently, they flossed, they used mouthwash as well. She did too, or well, she tried her best to, given her condition. So she sort of felt left out of her own home, she said, where everyone else could enjoy food and nice looking smiles, well, without a pool of blood in their mouths. So uh, she was pretty distressed about this. So before scheduling her for a cleaning, we prescribed her some blood work because her condition seemed a little curious, and we wanted some more information about what was maybe going on. So when the results came back, sure enough, it turned out her blood sugar levels were way above normal. And this was most likely the uncontrolled diabetes, which was magnifying, the problem in her gums. So we then eventually ended up referring her to a medical practitioner to start getting her diabetic status in order, and we undertook her cleaning as well. Well, after several months of diligent oral hygiene practice, coupled with dental checkups, along with, of course, a treatment plan for diabetes, her condition came back to within normal limits, and she started enjoying the benefits of having healthy gums. She could eat what she wanted again. She could smile with confidence. She now felt like she was part of her own home again because, she wasn't bleeding at the dining table anymore. And however, it's worth noting here that she'd already started benefiting the moment she turned up for her appointment when she did, because it was at that moment that she underwent a screening for diabetes, which was caught, and treatment was started before she could have had more serious complications from its uncontrolled nature. So it's important to understand that the mouth itself is not separate from the rest of your system or your body, however way you want to put it. And that something happening inside the mouth may actually have effects on the rest of your system, or be a reflection of what is going on elsewhere in the body. So gum disease in particular tends to be painless for the most part, which is why it is actually pretty easy to ignore. We need to realize the importance of visiting the dentist when we feel an issue is, beginning to crop up or emerge in the mouth. The dentist can help you nip these problems in the bud, and well, as we saw from the story, your dentist can actually help you take care of your overall health as well. So maybe something to keep in mind. Thanks.